Hello, my name is Preeti Bangia and I am the project lead for Millennium Collaborative Care's Cardiovascular Disease project. The agenda for this presentation is to give you, our listeners, a quick overview of the Cardiovascular Disease Management or Million Hearts project. I will provide my contact details at the end of this presentation. The goal of this project is to improve the management of cardiovascular conditions within community and ambulatory care settings. The long-term outcome of this project is to decrease the burden of cardiovascular disease in the adult Medicaid population. Million Hearts is focused on the ABCS, a set of evidence-based clinical quality measures to reduce current and future cardiac risk. These measures include A for aspirin therapy, B for blood pressure control, C for cholesterol management, and S for smoking cessation. To improve these ABCS metrics, the goal of the Million Hearts Initiative is to identify people at risk for cardiovascular disease, to ensure appropriate treatment, to reduce the need for blood pressure and cholesterol treatment, to promote healthy diets and improve physical activity, and finally, to support smoke-free environments. So why cardiovascular disease? How sick are people in Western New York when it comes to cardiovascular disease? To understand the cause of cardiovascular disease, we will first briefly describe what cardiovascular disease is. Cardiovascular disease is a disease that affects your heart and the vessels that carry blood to your brain, kidney, eyes, and even the arteries that supply your heart with blood. Cardiovascular disease includes high blood pressure and coronary heart disease and can cause strokes, blindness, and even kidney disease. Nationally, 1 in 3 people die of cardiovascular disease every year. Here are some statistics provided by the National Million Hearts Initiative. The Million Hearts Initiative is a national initiative to prevent 1 million heart attacks and strokes by 2017. Nationally, 1 person dies of cardiovascular disease every 40 seconds. There are 2,200 deaths per year caused as a result of cardiovascular disease. Among the 8 Western New York counties, about 30% of the population has diagnosed high blood pressure. Only 63% of Medicaid beneficiaries with diagnosed high blood pressure have their blood pressure under control. The leading cause of death in every county is cardiovascular disease related. The goal of the Cardiovascular Disease Project is to adopt Million Hearts goals by focusing on clinical quality of care by supporting heart attack and stroke prevention in physician practices. This means using electronic health records to identify patients and monitor blood pressure within the practice, and adopting practice workflows that address cardiovascular disease. The second goal is to coordinate patient services within practices and with other healthcare facilities and community-based organizations. The third goal is to support wellness education of patients through programs that teach patients about healthy behaviors related to diet, exercise, and quitting smoking, a leading cause of death and disability. Now, it's important to note that our health behaviors such as diet, exercise, and nutrition account for 40% of our health outcomes, our length and quality of life. Therefore, significant resources will be devoted to improving behaviors within community settings to improve the prevention and management of cardiovascular disease and other chronic conditions. The goal of this project is to work in tandem with the efforts of the National Million Hearts Initiative and prevent heart attacks and strokes in the Western New York region. Within clinical settings, the focus of the Million Hearts Initiative lies on heart attack and stroke prevention by using health information technology to monitor the ABCS. These are clinical quality measures. Using patient registries to guide pre-visit planning and ongoing monitoring and follow-up, and educating patients about their medications, providing educational information about their condition, and helping them set self-management goals. There are many primary care strategies that can be adopted to monitor cardiovascular disease. For the Million Hearts Project, Millennium Collaborative Care will support safety net practices in several ways, including setting regional standards of care for aspirin therapy, blood pressure control, cholesterol management, and smoking cessation, supporting PCMH accreditation and care coordination teams, including nursing, pharmacy, dietitians, and community educators to address lifestyle changes and blood pressure medication management. Working with practices on setting up high blood pressure registries to identify patients with complex chronic conditions for care management, and using electronic health record systems to develop point-of-care reminders to monitor patients with high blood pressure and high cholesterol. Tracking patients in their journey to improve their heart health will require that primary care practices develop quality improvement initiatives. Practices will use a high blood pressure registry to generate a list of patients who have not had a recent visit and set up follow-up appointments to continue to monitor their cardiovascular conditions. Primary care practices will play a key role in improving the patient's education about their chronic conditions. This requires working with patients on goal setting related to diet, exercise, and smoking cessation, and taking medications, and then reviewing the patient goal at every follow-up appointment. Self-management education offered to every patient at the primary care practice will be tracked by Millennium for the Department of Health as a part of patient engagement reporting. Patients with complex chronic and a comorbid behavioral health condition will be referred to health homes for ongoing case management if appropriate. There are also several community strategies that will be used to prevent heart attacks and strokes. The long-term outcome is to decrease the burden of cardiovascular disease in this population. The project objectives also include improving care coordination, using care coordinators and/or pharmacists as non-physician team members in blood pressure management in both community and healthcare settings. Patients also have the ability to self-manage their condition by monitoring their blood pressure regularly. Regular measurement of blood pressure outside clinical practices, either at home using a blood pressure measurement device or at a community location such as a pharmacy or a library, is a key strategy that can reduce the risk of disability or death. As a project goal, Millennium will work to support patients monitoring their blood pressure using a home blood pressure monitor or at a community location. Measuring blood pressure between office visits will serve to encourage active engagement in a person's ability to self-manage. Despite this coordination and support within the practice, for individuals with multiple chronic conditions such as heart disease, diabetes, or persons with significant mental illness, there exists a lack of coordinated care between multiple healthcare settings. Patients moving from one setting to another find it a struggle to receive appropriate healthcare services. These folks are likely to be high utilizers of the healthcare safety net. For this population, targeted case management services is key to coordinating care among primary care and other healthcare providers. These patients may also qualify for health home services. Health homes provide targeted case management to make sure that everyone involved in the care of that person is working together to share information to support recovery. Health homes not only coordinate physical health services, but also mental health, substance abuse services, and social service needs of its members. In addition to healthcare service providers, community programs play an important role in managing chronic conditions. The Stanford Living Healthy Workshop, or CDSMP, is a 6-week evidence-based workshop designed to teach skills needed to manage chronic conditions. The Living Healthy Workshop is for anyone dealing with a chronic condition and their caregivers to teach people better nutrition, better exercise choices, and help them learn better ways to talk to their doctor and family about their health. Implementing these workshops in community-based settings and setting up referral mechanisms for healthcare providers to refer patients to such workshops will be a key strategy in helping people manage their chronic conditions. Millennium will work with community agencies and providers to support the ongoing referral and enrollment of patients in the regional Living Healthy workshops and developing ways to collect data for better patient self-management. Millennium will also work closely with the New York State Quit Line in supporting patients receiving tobacco cessation resources within primary care practices. The strategies used by the New York State Quit Line range from policies and procedures implemented in practices to addressing tobacco cessation to community-based smoking cessation resources, including coaching services and nicotine replacement therapy coverage available to support Medicaid patients. This project is dependent upon strong partnerships in order for it to be successful. These partnerships include those among primary care, specialty care, managed care companies, and region-wide PPSs, including community-based services such as health homes. Through the efforts of the Million Hearts Project and all of the district projects, opportunities to transform the healthcare service system will be identified. Transformation will require changing how patients access care and how care is delivered. The project contributes to this transformation by engaging both patients and providers in managing chronic conditions to seek the right care in the right place at the right time. This concludes our presentation of the Cardiovascular Disease Million Hearts project presentation. Thank you for listening. If you have any questions about the Cardiovascular Disease Million Hearts project, please contact Preeti Bangia at Millennium Collaborative Care at 716-898-1968 or pbangia@millenniumcc.org. Thank you.